It's almost October. Time for horror stories, right? Well, I got one for you. Written by the New York Times. Fragile NC residents lose Medicaid support for food and housing. The government is playing peekaboo with its funding. Uh, 1 year after Hurricane Helene, people in a hard hit western region of North Carolina can no longer rely on successful programs that help keep them afloat. So, North Carolina had this awesome program for people that were, it wasn't just for basically the ones that got hit hard. Medicaid was all across the state and it had pretty good funding. I'm going to read this article, but I just want to say this first. There was a once the funding was cut, and I believe it was cut early this year. North Carolina sued, or is suing, attempting to sue the federal government for the funding that has been cut because it is literally killing people. This is a absolute horror story. 5 years ago, North Carolina embarked on a bold experiment to road test the idea that providing nutritious food, safe housing, and transportation for doctors' visits can help fragile Medicaid recipients stay healthy and avoid costly hospital stays. For Christy Shelda, a single mother of two boys with complex medical needs, that meant receiving a weekly box of fresh produce. The provisions made it easy. The provisions made it easier to stick to the special diet that reduced the 15-year-old's trip to emergency room. uh, Kelly Prince, who learned she had become homeless while recuperating from a spinal surgery as a nightmare, was given a motel room for several weeks so she and her family didn't have to sleep in a car in a hospital parking lot. And Deborah Hensley, 60, who is partially blind and physically disabled, uh, the new roof and electrical work paid for by Medicaid program and Healthy Opportunity Pilot, or HOP, now allowed her to stay in the aging trailer she shares with her teenage grandson. It's not an exaggeration to say that HOP saved my life, Miss Hensley, gesturing to the holes in the ceiling that had previously channeled rain water into her living room. By many accounts, the $650 million set aside for North Carolina's Medicaid experiment was a success, and it enjoyed bipartisan support in the state's Republican-led General Assembly. Uh, an analysis by the UNC School of Medicine found that the program saved $1,000 annually for each of the 13,000 Medicaid recipients enrolled in the pilot, which covered three rural swatches of the state. And I just want to point out this picture because for like right now, since funding has been cut, this is just the reality. Like, this is how some people used to see their refrigerator, and now it's just on a picture of their phone, and that's the best that they have. Um, these are, I guess, these are some. Yeah, these are some of the people that is talked about. Uh, but the program is shutting down. An early casualty of the cuts to Medicaid that Congress approved in July, uh, in declining to renew funding, state Republican leaders cited looming reductions in federal health care spending in President Trump's legislation, which extends tax cuts and slashes social safety net programs. State lawmakers have until September 30th to reverse the course and fund the pilot for another 5 years, but many participating organizations have already discontinued services and some have shut down entirely. And this is the part that hurts so much because these people that run these organizations and these programs don't see this happening. So even if this comes, if they do like reverse the course, some of these programs may not be available if this funding is available again. Some of these programs just will not be here because they've already shut down. There's a lot of heartache and disappointment to watch the demise of something that was stabilizing the community and helping people get back on their feet. Uh, said uh, Lori Stradley, chief executive of Impact Health, and nonprofit in Asheville that help administrator program in Western North Carolina. We're going to see ripple effects for years to come. And I mean, these people that were hit by uh, Helene, some of them just had nothing. They just had nothing left. And they just, they lived for years and years and years um, in the back of the woods somewhere, and now their stuff is just gone. They don't have anything left because their places were destroyed. The funding that was there, that they were clinging on to help them, has disappeared. Um, the cuts are part of a 32 sorry 320 million dollar reduction in Medicaid spending in a North Carolina legislation that healthcare analysts say will significantly erode benefits for the state's 3 million Medicaid recipients. So this is something that just devastates everyone that had a part in these programs, especially in the ones that were surviving from it for like housing and things of that nature. The ones that also had surgeries come up that left them unable to work. It is extremely hard to get on disability, and people have gone homeless because of it. And now the funding that allowed them to, like I said earlier, just stay in hotels, all this is gone. Um, the pilot's cancellation has been especially just dispiriting for residents of Asheville, NC, and the surrounding counties and mountainous region still recovering from the catastrophic flooding brought by Helene almost exactly 1 year ago. Many people here say they feel abandoned by the Federal Emergency Management Agency, which in May announced it would no longer share of the cost of recovery efforts with the state. That is so sad. In recent years, the area has become a magnet for affluent re, uh, retirees and digital nomads drawn to the beauty of the Blue Ridge Mountains in Asheville, bustling art scene. Um, but in a state with this also doesn't help anything. A 7.25 minimum wage and the dizzying rise of housing prices has made the area increasingly affordable for low wage workers. I think I read, well, I know I read a report, and I think North Carolina was it was like a report that listed uh, the states by their minimum wage, and North Carolina was like, sorry, it was minimum wage, and also how the state laws affected the person's safety and workplace, and North Carolina ranked 49th. So it's pretty far down there. Um, this is so sad to read about, especially as a resident of North Carolina, because the whole, like, it's a beautiful state, but it just has lousy uh work work laws, work wages, and now on top of that, they're also cutting their uh the federal, I guess the federal government is cutting the Medicaid funding for, those who are hurt, those who've had disasters, those who are homeless, and to what cause no one knows, but these people are in they're in grave danger. Um, State Senator Ralph Hayes, uh, whose district and his district is included in the pilot, and a half dozen other Republican leaders in the General Assembly did not respond to interview requests. In public comments, some have cast doubts on the pilot's effectiveness. It's not clear from our side that any folks are really benefiting from the program anyway. Are you kidding? It's not clear from our side that any folks are really benefiting from the program anyway, even though there was a huge disaster that hit a year ago, and many people clung to these programs as a life vest to keep them afloat, and then they go and say something like this. So they basically don't give a shit about who they're killing. This is the trailer that they were talking about earlier, that uh, she had a huge leak in her roof, and it was able to be fixed thanks to the programs that were available by Medicaid. North Carolina decision offers a preview of the seismic changes facing American healthcare, as more than 900 million is expected and expected cuts to Medicaid take effect in the next decade. According to Congressional Budget Office, nearly 8 million people are projected to lose Medicaid coverage by 2034. Uh, after floodwaters, uh, after floodwaters coursed through her suburban Asheville house and sent the family fleeing into the dark, Miss Shalda and her two sons, both of whom have autism, spent months living in shelters and motels. Since November, they have been camping out in a donated recreational vehicle parked next to their water damaged home. North Carolina legislation seems to think we're just a bunch of hillbillies that don't deserve a helping hand. And you know what? I agree with that statement, because they no longer care about the repercussions that they bring upon the citizens. They no longer care about children, and you know having safe housing, safe place to grow up in, and nutritious food to eat. And it's so sad. It is so sad. This is an absolute horror story. Miss Mishola said of the decision to end the program, uh, Seth A. Uh, Berkowitz, a primary care doctor at the UNC School of Medicine, who has been evaluating the program for the Federal Centers of Medicare and Medicaid Services, said the pilot has been successfully helping families in crisis get back on their feet. We're talking about the a straw that broke the camel's back situation where families barely holding it together, and then someone loses their job, and then their car or their only car breaks down, he said. Although that's also not including natural disasters that just happened. Although spending for each particular uh, although spending for each participant initially increased as enrollees received prescribed services for, say, mold removal or ease a child's asthma symptoms, or Dr. Berkowitz found that over time, the spending trend declined. If you spend resources to get people through a rough patch, that translates down the line to better health and lower healthcare spending, he said. Yes, absolutely. Absolutely. This is a true statement. If you help your citizens will have a lower cost on the government because they will be able to help themselves later on once the government has helped them out of a rough patch. The government seems to no longer care about that. The pilot also boosted the local economy by distributing much of the funding through social service organizations, food banks, and farms across the regions. Many farmers have already planted their spring crops when they learned the program would be shutting down. For us, the timing is terrible, said uh, Deco- Decogliano. I hope I said that right. Who grows 30 kinds of organic vegetables in a sandy loam soil along the bed of the South River in Yancey County. Farmers have been getting hit so hard. Like, farmers have been getting hit so hard because of government cuts, and farmers are the ones who produce the food. So if farmers can no longer produce the food, I mean, it's just going to increase prices even more. And more people are just going to have to deal with or have to go through hunger, starvation, and death. Um, uh, the HOP revenue helped the family regain their footing after Helene devastated their farm, causing $25,000 in damage. And personally speaking, it was especially gratifying to know our food was going to help people who really needed it. Much of the farm's produce ended up in one of a dozen community markets to that operate in low-income neighborhoods in and around Asheville. The markets run by the nonprofit uh, Beauty and Soil resemble traditional farmer markets expect that shoppers do not pay for the farm fresh produce they drop in their bags. The community market served 26,000 people each month, roughly double before Helene, according to Paul Sailors, the deputy director of Bounty and Soil. The market will continue at the end of the hot pro. The market will continue, but the end of the hot program means that 260 Medicaid recipients won't uh, with serious health difficulties are no longer receiving the boxes of fruits, vegetables, and eggs that Bounty and Soil assemble each week. With its uh, micronutrients. Fresh produce is a foundation of good health. Miss Suller said, rather than chasing disease, supporting people's well-being is actually a smart economic choice and the humane choice. The produce was a godsend for Miss Shalda, tall, gentle, and wise beyond her years. Her eldest son, 15, was born with uh, hydro hydrocephalus, a buildup of fluid inside the brain. Oh my goodness. Over the years, he has endured a number of hospitalizations and surgeries, and he is especially susceptible to convulsions, seizures, and kidney stones. Uh, with uh, with his doctors, with Alex's doctor prescribed a complex of diet to reduce the frequency of both. Mashalda wept with frustration. 2 pages long, the diet was heavy in fresh vegetables, dairy, and meat items. All of these items are super expensive in the grocery store. I mean, very expensive in the grocery store, especially the meat. She could barely afford on the $700 in food stamps the family received each month. Uh, Hop. Um, so this is her family, I guess, living in. It says that they're living in temporary housing, while their home is repaired and from flood damage. The Hop food box is tailored to families' exacting dietary needs. Contain 2 dozen eggs, cheese, bread, and an array of seasonal produce. She was excited. She was so excited she would share photos with her of her food packed refrigerator with friends. Over time, the seizures and kidney stones that often sent her son Alex to the hospital began to decline. Um, no doubt because of healthy eating. And it's been such a relief to watch him run around crunching on carrots and peppers instead of junk food. Since the food deliveries ended in July, Miss uh, Sh- Shalda said she had been serving more frozen and canned vegetables. As she spoke, the boy made a face. The frozen carrots tasted like mush. The pain from his chronic kidney stone condition has recently begun to creep up because of the decline in nutrients in the food, probably. Um, Ms. Sanders fears things will only get worse as federal cuts to Medicaid and food stamps take effect. No doubt they will. I feel overwhelmed just thinking about the future. Miss Prince, who is caring for 3 grandchildren, shares the anxiety um, since the family stopped receiving the weekly food boxes. Miss Price has been making the rounds to local food pantries, but few offer fresh produce, and most only allow one visit every 2 weeks. The kids really look forward to the strawberries, bananas, and eggs, she said. Have you seen the prices of eggs lately? And isn't this what the government is supposed to be doing anyway, to get kids to eat healthy fruits, vegetables, and be more active outside and live a healthier life? And instead, they are doing the exact opposite and cutting millions of kids food and uh, dooming them to a life of pain due to low nutrition in their food. Uh, so it's just the government completely just backpedaling, um, and basically forcing citizens into a worse way of life instead of improving it, because that's what a government is supposed to do. Um, with your grandchildren who were in the hospital recovering after a spell of small strokes. This is so sad. After 11 months living in shelters and motels, her husband found a $20 an hour job with the Asheville Housing Authority that allowed the family to rent a two-bedroom apartment in a nearby town in Black Mountain. But Miss Prince's income then made the family ineligible for the $137 monthly food stamps they had been receiving. Miss Prince also lost $790 in federal disability payments. This is the this is the cost of, of having a job. Oh, what's that? You went out and you decided to try and be a good citizen and find a job to support your family, and you succeeded in that. Well, now we're gonna punish you by cutting your funding, and there's nothing that you can really do about it. Oh, by the way, if you end up losing your job, you have to go through the system all over again and wait until your funding is approved again. And we don't care if you or your children are starving. It's this this has got to stop. This has got to stop, because this hurts so many people. This hurts so many people. And this is why people don't want to work. This is why people do not want to find a job. Because of her spouse's income, she has lost over $700 in disability. Even though the disability was for her, I'm guessing, or her son, she still loses it because her husband found a job. So uh it's like they're climbing out of a hole, and then the government just stomps on their head and their hands and pushes them back down deeper into the hole again. um because this does not help anyone ever. um cheery and seemingly cheery and seemingly uh uh indef- indef- indefatigable. Miss Prince, 55, has been unable to work in the years since she was injured in a car accident. So it is her disability, leaving her with a host of health issues. In July, she was diagnosed with breast cancer and underwent double uh, mas- mas- mastic mastic mastectomy. Uh, that's horrible. I'm so sorry that this happened to this poor woman. On a recent afternoon, Miss Prince described the the on a recent afternoon, Miss Prince described the troubles of rearing three children under 8 on a limited income while dealing with complications from her surgery. They include swelling, constant pain, and serious blood clots that alarmed her doctor. It's hard to recover properly when you can't get any sleep. True. And you're worried all the time about feeding your family, she said. As Clover, the youngest grandchild, uh, wriggled in his arms, rig- wiggled in her arms. In many ways, the Prince family uh, personifies the rational behind the HOP program. It helped the family emerge from homelessness, and food boxes provide the building blocks for healthy meals. On the flip side, the loss of that support highlights low stress of poverty. Highlights how the stress of poverty can negatively affect health. Yes, because poverty is a disability. Poverty is absolutely a disability, and it absolutely affects health. Because if you are impoverished, you cannot afford the nutritious foods to feed your family. I'm not one to complain, but it's been hell, she said, in a quiet in a quiet moment with her grandchildren out of earshot. A few days later, Miss Miss Prince was rushed to the emergency room after the right side of her body went numb. She could no longer speak. Doctor said she had suffered from a series of small strokes. After 5 days in the hospital, they sent her home with strict orders: eat well and avoid stress. Wow. Eat well. All you gotta do to get better is eat well and avoid stress, even though you can't afford the food and you're under constant stress to feed your family. Wow. Um, that's the end of this article. It is so horrifying that these programs are now being cut with people who have lost everything due to natural disasters, and the government is basically just kicking them in the face and telling them to go away. It's so sad. I'll put a link to the article to this article in the description. It is by the New York Times, so you probably have to make an account to see this article. Um, but I'll still uh, put the link in the description. I wonder. Let me go all the way down here. Um, yeah, I don't see anything where they're like. That's another thing they could do instead of just telling that this horror story. They could have put links down to donate for donations to programs that are open for you know uh, for like social services or whatever, to donate to help people get food inside of their houses, or help people just get housing that actually need it. But yeah, I don't see any of that on here. And uh, I did do a video a year ago on the Helene disaster, and I did link some of the funding that people are sorry some of the sites that people could donate to fund programs that help people out of these disasters. No clue if they're still open or not, though. This is an absolute horror story, though. Thanks for watching. Bye bye.